As more people become infected with the coronavirus, there's an ongoing debate about the use of masks. Should we wear them or shouldn't we?
Coronavirus is a respiratory disease, meaning it affects organs relating to respiration or breathing, such as the lungs. It's why since the outbreak in January, persons in countries where COVID-19 cases have spiked have been seen wearing masks. On its website, the World Health Organization, WHO, noted that in some countries, including Japan and South Korea, masks are distributed to the public. For others, including the Czech Republic and Slovakia, it's mandatory.
Everyone who has to leave their house has to wear a face mask.
On the other hand, in February, the U.S. Surgeon General told the public to stop buying masks. This was repeated in Jamaica as the N95 surgical masks were running short for healthcare professionals. Managing Director of Medical Disposables and Supplies in Kingston, Kurt Booth, says there has been an overwhelming demand for masks since January.
It started with the N95 mask, extended to regular surgeon masks, and just wild requests for any types of masks.
A recent social media post suggesting that the coronavirus had gone airborne increased that demand locally. Former Chief Medical Officer and now PNP candidate for the East Central St. Catherine seat, Dr. Winston Delahaye, is appealing to Jamaicans to start wearing masks. He initially discouraged the wearing of masks in line with the WHO guidelines.
I've changed my position. I've been following, like you, the media, the happenings in different countries, Spain, Italy, the Czech Republic. I have friends in these places who have indicated. They are very clear. They have been for some time. I am now clear as of last evening, and in fact have my own mask, which I'm now recommending that all persons, where possible, all persons wear masks.
However, Professor of Public Health at the University of the West Indies, Mona, Peter Figueroa, believes the public is misguided about the purpose of wearing a mask.
The advice that I think WHO has been given is that anybody who is coughing or sneezing or who has respiratory symptoms should use a mask in order to prevent the droplet spread from the coughing or sneezing. It stays within their mask.
The WHO has since debunked the claim of the virus being airborne. However, the increased demand for masks continues. Medical officials are again warning that unnecessary mask use may do more harm than good. Mr. Booth of Medical Disposables and Supplies explains that he has had to take steps to prevent a health catastrophe.
Now, the World Health Organization, WHO, has again weighed in on the debate about the wide-scale use of masks by the public in fighting the spread of COVID-19. At the organization's COVID-19 Daily Press briefing on Tuesday, the WHO head reiterated its view that masks should only be used by persons who are sick and those who are caring for them. However, he acknowledged that the organization and the world are still learning about COVID-19.
And we're learning all the time. As the pandemic evolves, so does the evidence, and so does our advice.